Well, welcome to the December AMSA talks. And I'm here with Jason Lerner of the University of Chicago Health Labs. And Jason, you have just released a report on the Chicago Cares program that we posted in the AMSA newsletter last week, and we'll post it again underneath this interview. But just a chance to talk with Jason about the report and its impact. Welcome.
Thank you. Thank you, Jason. I'm happy to be here.
So, why don't we start by you telling me a little bit about what does it take to do a report like this? What does it take institutionally for the health labs to do this, and what kind of personnel are you looking at?
Well, one of the things I'm really proud about is our approach with this was really a sort of quasi-embedded approach. And by that, I mean we had staff who were involved in almost every aspect of the planning and implementation process. Weren't riding on the vans or anything like that, of course, but we were in multiple meetings every week, from leadership meetings discussing the logistics and doing some of the planning to data and quality assurance type meetings when staff members were reviewing the data that were coming in. And so it was a very close partnership that we had. As evaluators, we, of course, were not making any of the decisions, but we were witness to the partnership, the engagement between these very disparate partners and how they came together and negotiated and made decisions. And so I think that our study benefited from our being a fly on the wall in so many of these meetings. I was looking at some of our numbers the other day, and we were involved in these over 500 hours of meetings alone that we were in, that we were sort of observing, capturing notes. We've many hundreds of pages of notes that we took during these processes, and so we were able to translate a lot of that into the report.
And tell me what the degree of independence the report has from the city of Chicago.
So we take pride in being an independent research organization. So we were close partners with the city in terms of being a fly on the wall, but we raised funding for this separately. One of the things we did was that we went in partnership with the city to philanthropic partners to make the pitch about why this work and our study of it was so important. But we didn't take any money from the city, and so we were in that way we were very independent.
It really builds on the credibility and the authenticity of the report. That's great
It's
to
part of
hear.
our philosophy is that for a number of reasons, cities and municipalities should not be paying for their own studies. I think optically that can create some challenges, and also that public money can be better spent elsewhere than paying folks like us.
Yeah, and it's so great you have generous philanthropists like the Joyce Foundation and others to do that for you. Um, to talk, say a little bit about your approach to this evaluation.
So what we conducted, what we call an implementation evaluation. A lot of
Mm,
times people hear evaluation and they sort of automatically think about an outcome evaluation.
mhm.
We're certainly interested in those as well, where you sort of randomize through, RCT or something like that. This was not that. This was a pilot program in the very early stages. And so what we did was a multi methodology based evaluation, a lot of qualitative. So we interviewed, we did key informant interviews with staff and leadership to understand from all of the participating agencies to understand their perspective on what's working, what's not working, and things like that. We also got 5 years of administrative data from all of the participating agencies as
Mm.
well. Some of that data obviously pre-existed CARE because CARE has not been around for 5 years, but we got the programmatic data as well. And so we combine those methods, and you'll see that in the report in some respects, but we do have a separate report based solely on our qualitative work that will be coming out shortly as well. But we take this mixed methods approach, and we're seeking to understand the dynamics of the program. We want to understand operationally how it's working, the decision making, particularly in Chicago, where you have a few different agencies coming together and operating a program in many respects for the first time. So we wanted to understand how the implementation was planned, how it came together, how the partners um, negotiated among themselves about making decisions for the program. Of course, we want to look at the impacts of the program and more like outputs. How many calls did they go to? What success rate did they have in getting to meet the individuals and things like that? But we were not specifically looking at outcomes, like did it reduce arrests or
Hmm.
something like that.
Hmm. I love Chicago, but it is not your average American city. You mentioned participating agencies. Give us a hint on who those are.
Yeah, so the Chicago model was in many respects one of the more operationally complex models that are out there. So the partnership involved first of all the Office of Emergency Management and Communications, the 911 call center.
Mm.
They
Hmm.
were an active participant. And then the folks riding, doing the response, there were teams of consisting of 2 and 3 individuals from different agencies. And
Mm.
so we had folks from CDPH, the Chicago Department of Public Health. They were the mental health clinicians that were part of these teams. Community paramedic from the Chicago Fire Department. And
Mm.
for some of the teams, specially trained CIT, crisis intervention training, trained CPD police officers.
So those two teams, those are going on different call types, I assume.
So the call types were not different, and a lot
Hmm.
of the pilot was sort of figuring out where the teams are sort of best positioned to respond. So there was a handful of call types that were outlined for that these teams, no matter which configuration, could go to. The first team to launch were what we call the multidisciplinary response teams. Those are the 3-person teams from consisting of the CPD paramedic, the CPD officer, and the CDP clinician. And then about, I don't have the exact date in front of me, but about a year later, the alternate response teams consisting of the paramedic and the clinician rolled out as well. And what generally wound up happening is, in theory, the teams with the CIT police officer could go to slightly elevated risk calls. So where there may be some concern about potential, like not violence, but if someone was punching, kicking, spitting, something
Mm.
like that, something where there's an indicator of something like that, they were able to go to those calls, whereas the teams without the police officer couldn't go to as many of those.
Okay. That gives us a good picture of some of the complexity. Why don't you walk us through the report and tell us what you found out?
Yeah, so the report consists of, first we give a background of what's the mental health landscape in Chicago
Mm.
looks like, and how each of the agencies participates in that outside of care. Talk about how the partnership between the agencies and sort of the genesis of the idea for the care program, and then we get into the analysis of the available data, and so much of the report is dedicated to looking at the call data and how that the teams responded to. So we examined things like the sheer number of calls that they were able to go to, the dispositions of those calls, were they successfully able to meet the individual and things like that. We got a really interesting data set from the health department as well. So their clinicians were doing assessments and things like that when they got to the scene. And so they shared, this was all de-identified, but they shared de-identified case notes
Mm.
from those interactions. And we did some really interesting analyses based on those. One of the more interesting findings that we had is when the care teams met with individuals, they sort of assessed their level of distress. So they asked the individual sort of, when you go to into the hospital and they ask you to rate your pain level and do a
Hmm.
similar assessment for the person's level of distress. And we found a statistically significant drop in the individual's perception of their distress during the course of the interaction, something like a
Okay.
20% reduction, which we thought was a really meaningful finding. Again, we didn't do this as an outcome evaluation, but we take the data as we find it, and that was one of the more interesting findings.
Did you also found that a fairly high number, really almost the majority of calls are people in some behavioral health crisis, some sort or another.
That's right. We found lots of indicators of folks displaying symptoms of depression or anxiety, of schizophrenia or schizophrenia related symptoms, substance use, of course. They had a third team model that was dedicated to going not to
Mm.
911 calls about substance use and overdose, but they would specifically do follow ups in the day or two after someone had an overdose event.
Cool.
So, of course, we see
Great.
lots of data related to substance use and things like that as well.
Right. And as you're walking through this, what are the what was surprising to you in the learning about the Chicago Cares? What did you learn that you didn't expect to learn?
Well, one of the final sections in the report is based not on the data that were shared with us, and also not on the key informant interviews that we
Mm.
did, but was really based on the body of interactions that we had as a research organization observing the planning and
Oh,
implementation process. So we have a synopsis of the key lessons learned just from being a fly on the wall. And some of the lessons, in my opinion, that we include there are some of the more meaningful lessons that I think are in the report. And so one of the things that jumped out at us early on is for the public and even those of us who do the work, when you think of these programs, you think of the sort of very high level questions that, what sort of calls should these teams be going to? Should police be involved or should they not be involved? What about safety of these teams and things like that? And of course, those are very important questions.
hmm.
But one of the things that stood out to us was how important an impact that much more rather mundane questions came to impact the pilot. And what I mean by that
Mm.
is, in the Chicago context, at least, we had these disparate agencies as we spoke about, but they each came to the partnership with their own long histories and
Hmm.
traditions and standard operating procedures and union agreements and things that you don't really think about when you think about programs like this specifically, but turned out to have a really major impact on the operations. And so one thing in particular stood out to me, the negotiation that had to take place about the uniforms that these teams would wear. If you
Mm.
think about the police department, the fire department in any city, they're going to have regulations about what their staff should be wearing. And I think all of the partners agreed from the get-go that these should not be these staff should not be dressed like standard, first responders. They shouldn't have police uniforms, they shouldn't have fire uniforms. But sort of getting beyond that general agreement to, okay, this is what they're going to look like. They're going to be wearing khakis and a polo with the logo here. That all required separate negotiations by each of the agency personnel, and getting it through their legal teams or whatever. And that took quite a long time. And I suspect that other cities that are doing this involving disparate agencies will run into the same thing. It was the same thing with uh, finding the vehicles for the teams to use, and sort of
Mm.
the each agency had different regulations about what their vehicles should be. So these rather mundane questions wound up having a significant impact on the timing, when the pilot launched, and things like that.
It's fascinating that it's the devil in the details that.
A lot of details that no
Mhm.
you don't really think about before you get into these programs. And
Right. And so often policy people come in with these highfalutin ideas, oughts and shoulds, and it turns out, well, is it, what's the length of my jacket going to look like?
That's right. And the staff and leadership who were involved in the day-to-day operations of care were very dedicated, and I think they approached questions like that with an open mind and ready to negotiate, but despite the best of intentions by everyone participating, there's just a process that needs to happen, and it has an impact.
It sounds like we're so early in this learning about what mobile crisis is right now. It's hard to even know what the right questions to ask are.
Hmm.
And so as you come through and you're done with this now, two questions. One is what is the question that went unanswered? And maybe it can't be answered today, but it might be answered in 10 years. And what's the expected impact of your research?
Well, I think there's a lot of questions that we don't know the answer to now. I think one thing that studies like ours of care show is that, uh, in my opinion, these programs work. You know, they can be done safely, they can be done effectively. There's so much to learn from all of them. And as you just sort of indicated, there's so many models, there's so many iterations. You know, you have community led, you have government run, and a lot of variation in between about who the personnel are that make up these teams. And I think there's a lot to learn from all of them. And that's not even to get into the different context in which they all operate,
Mhm.
large cities, suburban areas, rural areas. And so, um, it's not our job as evaluators to sort of tell communities what model that they should operate. You know, they are the experts about the context in which these programs will be operating. But I think what we can do is help them understand what's happening when they do launch these things. And I encourage other jurisdictions who are experimenting with these programs or thinking about doing so to involve evaluators like us from the beginning to help document what you're doing, to help you as the policymaker, as the operator, understand what's happening, what's working, and why. And I think that that's a process. It's a sort of a natural process in a new field like this that has to happen, and it is happening. We're not at the end of the road yet to sort of say with any definitiveness, this works, this doesn't work. And I think that's where we will be in 10 years, is we'll have a better understanding of what works and why, hopefully, if we do this right. And that's what I'm most excited about.
And what's your hope for the impact of this research?
Well, uh, as exciting and dynamic as this field is, and I think there has been for a number of years a lot of excitement about these programs, and rightfully so. Um, there isn't a lot of research. We're starting to see some now. There are a couple of impact evaluations and a few other studies like ours that are more process oriented, but it's a burgeoning field, the literature around these programs and how they work and if they work and why. And so I think that our study is one that was done rigorously. It's over 2 years of engagement in this very complex program. And so I'm excited. I hope people read it. I think there's a lot to take out of it, whether it's about if you're interested in operating a program in another big city like Chicago or another context, I think there's a lot of lessons to be learned.
Well, thanks, Jason Lerner. Thanks for talking to us about your evaluation of the Chicago Cares program. We'll put the link in the below this video so people can look at it for themselves. Thank you so much.
Thank you, Jason.